Hello doctors. Today let's talk about joint disorders. Now, joint disorders are usually a common problem in the old age people. So, this is an important topic. Now, let's see the most correlated topics with orthopedics regarding joint disorders. Let's start. First topic is ankylosing spondylitis. Ironically, we are starting with a topic in which it commonly affects young people, mostly males. It is associated with human leukocyte antigen B27, as many other diseases are affected like this. This is a common antigen to be noted. Now, what are the features of ankylosing spondylitis? The first one is pain in the sacroiliac joint. Now, what is the sacroiliac joint? This part. This part is the sacrum. This is the iliac bone. The, this is the sacroiliac joint. The patient usually has lower back pain, which refers to the sacroiliac pain. The patient will also have loss of spine extension, so the patient would not sit straight. He will usually have an hunchback. The patient will also have anterior uveitis in the eyes. In this disease, the hands are usually spared. Now, some of the Xray features are erosion of the sacroiliac joints, the vertebral body that usually gets squared. Normally, you can see there will be a small curvature here in the lateral view of the X-ray spine, but in AS, you can see the curve is lost and the vertebral body has now become in a shape of square. This is squaring of vertebral body. Dagger sign. If you can see here, this is a dagger. The spine has ligaments that usually thicken and calcify, forming like a dagger. This is dagger sign. And bamboo spine. The ligaments that usually turn out to become bones, and this causes fusion of the vertebrae. The fusion of the vertebra due to compression will have a curves like this. This is bamboo spine. The other worth signs noted for this disease are trolley track sign and Romanes sign. Now the next disease is Charcoalsarthropathy. This is a neuropathic joint disorder. The joint problem here is due to some neuropathy. This disease is usually painless because there is loss of proprioception nerve fibers. The nerves are being lost completely. So there will usually be no pain in this problem. This is seen mostly in diabetes, leprosy, Tapes dorsalis, that is syphilis, alcoholism, and syringomyelia. We all know that diabetes mellitus commonly causes neuropathies, and that neuropathies can lead to some joint disorders in the knee and in the foot. This is Charcoalsarthropathy. The point to be noted is it is painless. Now, you can see here, you may think this is a topic on dwarfism. Yes, it is. It is Achondroplasia. This is disproportionate dwarfism. I'll tell you what's that in a minute. These patients usually do not have any mental retardation, and the features are starfish hand and or trident hand. If you see this diagram, these are the two X-rays of these two patients. Here you can see the axial skeleton, that is the skull and the torso. This is same in both of the individuals, the height. But if you see the appendicular skeleton, that is the limbs, normally we have long limbs, but patients with achondroplasia will have short limbs. The problem is mainly in the appendicular skeleton. Now, this is a starfish hand or a trident hand. In Achondroplasia, there are Xray features such as bullet vertebrae and bird beak vertebrae. If you can see here, these vertebrae normally lose their sharp edges and now become curved in the borders. This looks like a bullet. This is bullet vertebrae. You can see here. This is also called as bird beak vertebrae. The patients also have champagne glass pelvis. You can see here, this pelvis looks like a champagne glass, the pelvic outlet. The next disease is osteopetrosis. This is also called as marble bone disease or Albach-Schonberg disease. This Albach-Schonberg disease is like osteopetrosis. It's one of the types of osteopetrosis, but it's usually generally called the same name. The problem here is osteoclast defect. Normally these osteoblasts, these are bone forming cells. They form the bone. But these osteoclasts, they are bone resorbing cells. They resorb the bone. If there is a defect in the osteoclast, then there will only be osteoblast activity. So the bone will grow. It will keep growing. You may think it is good, but no. It can usually weaken the bone. In the X-ray, you can see a bone within a bone appearance. Here, this is a bone and you can see inside a bone appearance. This is Erlenmeyer flask deformity. You can see it's like a flask. The patients will also have Ruger-Jesse spine with this sandwiched vertebrae. Next disease is gout, usually seen in middle-aged men. This is an important topic. The problem here is purine metabolism. The patients usually have monosodium urate monohydrate crystals. These are these crystals. You can see these crystal shaped. These are needle shaped and these are negatively birefringent. The most common joint is affected is first MTP, metatarsobphalangeal joint. This one will also be called as podagra. Now we can see a new bone growth here. This is Martel's sign. To diagnose this we have to do joint aspiration and we can see the uric acids. Next disease is pseudogout. The problem here is degeneration, degenerative joint disorder. You can see calcium pyrophosphate dihydrate crystals which are rhomboid shape. These are positively birefringent. The most commonly affected joint is knee joint. We can diagnose this with the X-ray. Osteoarthritis. The most common joint affected is knee joint. The metacarpophalangeal joints are spared. If you can see, this osteoarthritis will have certain defects like genu varus. That is, both the knees are far away from each other. That is, bowed legs. And you can also have reduction in joint spaces in the knee. In the knee, usually there is a synovial fluid. So, if there is loss of synovial fluid, the bone and the femur and the lower bones like tibia will come in contact. That will cause a lot of pain. These patients will also have head-beaten nodes and Bouchard nodes. Bouchard nodes are usually at the bottom. This is proximal interphalangeal joint. This is distal interphalangeal joints. These are the phalanges, the fingers. In the proximal interphalangeal joint, you will have the Bouchard nodes. In the distal interphalangeal joint, you will have the head-beaten nodes. This is rheumatoid arthritis. Most common joint affected is metacarpophalangeal joints. Remember that in osteoarthritis, MCP joint was spared. Here, in the joint spared is DIP, distal interphalangeal joints. The defects seen here are swan neck deformity. This is the swan neck deformity. The proximal interphalangeal joint is hyperextended while the distal interphalangeal joint is flexed. This is swan neck. Botonius deformity or buttonhole deformity. The PIP is flexed while DIP is hyperextended. We can also see windswept deformity. The patient will have both genu valgum and genu varum. This is like a wind has been swept like this. So this is windswept deformity seen in rheumatoid arthritis. Thank you, doctors.